Okay, so this is the second video, which the first video I will put the link in the descriptions. This is all about basic dysrhythmia class. So we are going to do some practice and scenarios. Okay, so this is normal sinus rhythm and also denotes as NSR. So when you actually get to see the ECG strip or EKG strip, America we call it EKG, and remember, you might be seeing like a whole strip but like longer or more, the whole page, right? But what you have to look at is 6 seconds, then you can interpret. Okay, so whenever you see this box, which is right here, it is 1 second. So 1 second, 2 seconds, 3, 4, 5, 6 seconds. So this is 6 seconds. So that's very important, because when you actually in the clinical setting, in the real setting, real world, you might see like a longer strip that you're not going to count the whole strip. You're only counting for the 6 second strips. Okay, because I have done that and I surprised myself what happened, and then I realized it's only counting for 6 seconds. Okay, so okay, anyway, first you look at the rhythm first. Okay, when you look at the rhythm, if it is regular or irregular, look at those R. Okay, those spikes are R spike. So R to the R interval, they are the same, so it's regular, right? So the rhythm is regular. Good. What about rate? So when you look at the strips in the 6 seconds, 1, 2, 3, 4, 5, 6, 7, 8 times 10 is 80 beats per minute, which is 60 to 100 beats is normal. So that's normal, right, for the adult. But for the children, depends on the age and the size, because the smaller you are, the smaller the children is, the heart is smaller. When it's smaller, it has to pump faster so that the blood will get more to spread to the body. Okay, to supply to the body. Okay, P wave. Is there any P wave? Right here is a P wave before QRS, P before QRS, P before QRS, P before QRS. Everywhere there's a P. Okay, one P wave in front of every QRS all look the same, and the P look the same. They all look the same. Okay, and PR interval. PR interval actually start from the P ends right before QRS. So right here, from here to here. Okay, not here. Okay, here. So let's see, 1 box, 2 box, and about 3 box. 1 box is 0.4 second, 3 boxes 0.12 second. PR interval has to be 3 to 5 boxes. So this is like 3 box, so this is good. Okay, so 0.12 means 3 boxes, 0.2 means 5 boxes, because 1 box is 0.4. You got it, right? Okay, take a second and think about it. Okay, this little box is 0.4 second. So when you have 3 boxes, it's 0.12 second. When you have 5 boxes, 0.2 second. Got it? Okay, and constant in adults PRI, which is PR interval, in constant and PR interval will be shorter in small children. You know why? Because small children has the small heart, so the atrium pump faster. Okay, and QRS means ventricular contractions. So when you count the QRS, look at this, QRS starting from here to the here. Okay, just to be making sure, I want to refresh myself. Look at this QR. Hold on. Okay, this is P. PR, this is PR, finish right here, not until here. This is R, but it doesn't come until to the R. It ends at the Q. Okay, I don't know why they call PR. It has to be PQ. It should be called PQ. So QRS is starting from the Q, R, and S. So ends of the S, that's what QRS. Okay, starting from Q and ends of the S. Okay, so look at this. Okay, QRS right here. ends of the S, okay, until here. So 1 box, kind of 2 box. QRS shouldn't be more than 3 boxes. It shouldn't be more than 0.12. It has to be less than 0.12 and constant shape. Okay, so that's no atopic. Atopic means like there's something unique going on in the rhythms, you know. It's something is like unique, you know, it's kind of like different than others. It doesn't have atopic. That means all constant. So because this is all good rhythm, good rate, good, there's a P wave, PR intervals within range, QRS within range, so usually there's no treatment because that's normal. Okay, next. So this one, what do you think it is? We don't know. Let's just not look at it like that. Okay, if it is 6 strips, 1 2 3 4 5 6 6-second strip, and we're gonna see those rhythms are regular. Okay, they are regular. What about rate? 1 2 3 4 5 6 7 8 80 beats per minute. What about P wave? There's a P, there's a P, the P before QRS, P before QRS. Okay, PR interval. Let's count. 1 boxes, 2 boxes, 3 boxes. It ends until right before starting the Q. So 1 2 3. So that's good because it has to be 3 to 5 boxes. And look at the QRS. QRS ends right here. Okay, so we have 1 2 and 3 boxes. Technically 1 2 and 3 boxes. Okay, so that's good. It has to be is 3 boxes or less than 3 boxes for QRS. So that's good, right? And rhythm, so it can be called normal sinus rhythm because rate is good, less than is 60 to 100 beats per minute. This is only 80, so all good. Okay, this is normal sinus rhythm. Okay, let's go bradycardia. Cardia, that means heart. Okay, brady means slow, so slow heart, right? Because that could be called bradycypnia. That's kind of like breathing. So just let's not confuse that. Cardia is for heart. Okay, sinus means it is a rhythm. Okay, sinus, if you don't remember sinus, that's fine. Bradycardia. Okay, so let's do this one. Rhythm. Are they regular? Kind of regular. Good. And is that 6-second strips? Yes, that's 6-second strips. Only 6 seconds. And the rate 1 2 3 4. So it's about 4. So from here to here, maybe about 1. So you can be called 40 to 50 beats per minute, but it's not 60, which is 60 to 100 is regular. So that means normal. That means this is brady, low heart rate, right? Slow heart rate. Okay. Then the rate, okay, 60 beats per minute. In children, the rate is dependent on their age and the weight. For the children, this is bad. I mean, you probably need to do CPR because for the normal adult, not so bad because, you know, it's 40 to 60, it's slow heart rate, that's right, but it's not kind of dying yet. Okay, P wave. P wave, is that a P wave? Yes, P. So P are good. What about PR interval? 1 box, 2 box, almost 3 boxes. So let's say 3 boxes, 3 to 4 boxes, we're good. QRS, okay, starting from here, 1 2 and 3 boxes. Okay, so let me see this QR interval real quick. Okay, QRS, yeah, sorry, because I want to make sure this QRS are less than 0.12. Okay, good. Okay, so it doesn't come up until here. It's only here. It's only here, right here. It doesn't come up until here. Okay, so we're gonna go back. So 1 2 and 3, I would say from it ends around here. 1 2 and 3, about that. It's right here. Okay, so that's good. Okay, and it's less than 0.12. Okay, good. And also constant, it's the same as every beats, right? Every time you see PQRS, that means a heartbeat one time. And treatment, okay, so if a dog is asymptomatic, treatment, if a dog is asymptomatic, treat with atropine 1 mg. Atropine makes the heart rate goes up. So since the heart rate is slow, we're gonna give atropine to make the heart rate goes up. But it all depends on the doctor. We tell the doctor will we might already know what the doctor's gonna give, but legally doctors give them order for the medicine. Okay, causes. So it could be acute MI, which means myocardial infarction, which means that the heart is dying because the heart supply, the blood supply to the heart is not enough. Okay, or vomiting. Now vomiting, when you vomit, you're actually squeezing the internal pressure of the abdomen. Like for example, if you're constipated and you're pushing the stuff down to the toilet and things like that, whenever you kind of push internal pressure of the abdomen, you can have the bradycardia. Okay, increased intracranial pressure, that means intracranial pressure is in the brain. So when you got the head injury, you got something swollen in your head, then you starting to have the intracranial pressure that will make you vomit or make your heart rate go slower. And vagal maneuver, that's what I'm talking about. Like whenever like you try to push the poop down into the toilet or something like that, or you sit in the toilet for too long and without you knowing it, you're actually pushing the stuff down to the toilet and you're pushing it, you know, actually putting more pressure to the abdomen, so vagal maneuver happen, then you have this problem. And some people, believe or not, they even pass out in the bathroom because they sit in the bathroom for too long. Okay, drugs example, calcium channel beta blocker or digitalis. Okay, hold on a second. So when those drugs, okay, actually can cause the bradycardia when the patients got on this drugs. Okay, like beta blocker, for example, like metoprolol, okay, LOL, and calcium channel blocker is something like amlodipine, something like that. Okay, and those medicine can make the heart rate slower, and also like digoxin, okay, can make the heart rate slower. That's why you want to make sure the adult heart rate is about 60, which is the apex beat. Okay, the apex beat is 60 before you give digoxin, because otherwise you're gonna actually make the heart rate slower than already is. Hypoxia. So hypoxia means less oxygen in the blood, so the heart is actually pumping blood, but it's kind of less quality, less oxygen blood, which the blood also comes right back to the heart vessel to supply the heart itself. That is also has less oxygen, so couldn't do the job better. Okay, sinus bradycardia, signs and rhythm, symptom. So when you got the sinus bradycardia, okay, the heart is pumping slower than normal. You can have chest pain, you can have shortness of breath, you can have loss of consciousness, decreased loss of consciousness. Hey, decreased loss of consciousness. Okay, decreased blood pressure. I would say decreased consciousness. Oh my God, decreased loss of consciousness. And skin cold and clammy. Okay, because you're starting to have like loss of consciousness, dizzy. Remember I told you like people can even pass out in the bathroom. And skin cold and clammy, and decreased peripheral pulse. That means the pulse. Peripheral means like not central, not closer to the body, is peripheral, which is like, you know, your pedal pulse, your popliteal pulse, and the radial pulse and stuff like that. Okay, so treatments in adult. If symptomatic, that means you have the heart rate slow, at the same time you have those symptoms: chest pain, shortness of breath, loss of consciousness, blood pressure low, skin cold and clammy, and decreased peripheral pulses. What are we supposed to be doing? And the treatment should be like atropine 1 milligram IV push. Maximum dose is 3 mg. So if the doctors probably happen to give like 5 mg, you as a nurse has the knowledge, you can alert him. Okay, we help each other out. Okay, all adult monitor units have a dysrhythmia protocol for symptomatic bradycardia. Okay, sorry, you don't need this part. Okay. So every hospital has like some sort of protocol what to do, you know. So for us, treatment in children, bradycardia is the most common lethal dysrhythmia in children. Clearly, sorry, if for the kids, you don't want the bradycardia because the kid's heart is so small that it has to be pumping fast enough to supply all the blood to the vital organs and the brain. But if it is brady, it can be lethal. It can be dying. Okay. Okay. For children, if the heart rate is less than 60, that means, I told you, right, that have to be probably start having CPR already because it's hypoxia. The kid is not really having oxygen enough to the brain and the other vital organs. Treatment: 100% oxygen for the children, back, forth, mask, ventilate, epinephrine 0.1 milliliter per kilogram, because I don't know how small the kids is, so like 10 kg, 20 kg, or maybe I don't know like how small the kids is. Okay, 1:10,000 strength IV push. Cardiac transplant. Atropine is a vagolytic medication. During the cardiac transplant surgery, the vagal plexus is cut. Therefore, atropine will not increase heart rate for cardiac transplant patient. So if your patient is cardiac transplant patient, you might forget about atropine because it's not going to do anything. Treatment is typically esoprel or epinephrine drip. Just remember that, otherwise be waste of time. Okay, so let's do the case study. Case study: a 16-year-old cross-country runner. Okay, cross-country runner. So that means this person is very so let's do a case study about bradycardia. Okay, so it says at 16 years old, remember the age is 16, not too old, cross-country runner. What does he do? He is a runner. That means it's not just a little runner, it's cross-country runner, so it's a sporty person admitted with anorexia nervosa. Anorexia nervosa is a condition that that person is very scared of putting on weight, so they usually either don't eat or throw up, not to have overweight. So anyhow, this person admitted anorexia nervosa, low body weight, for acute management. Vital signs: temperature is 96.8, so it's normal. Okay, 99.5 starting to be like low grade fever, but it's still okay. 100, 101, 101.5 we start to worry. Okay, and pulse rate is 40. Look at pulse rate, 40. The usual pulse rate has to be 60 to 100, right? So this is 40, kind of low, isn't it? And the blood pressure 98 to 56, kind of in the low side, but you don't need to worry too much because she is only 16 years old and also athletic. Some people has the blood pressure low, and we have the low blood pressure. The blood pressure is like a lower side and coming up and up and up, higher and higher and higher by the age. Okay, the older we get, the higher the blood pressure gonna be, but you shouldn't be like higher than 140 over 90, whichever age you are at. Okay, so anyhow, this is okay, this is okay, this is not okay. It is kind of bradycardia. Okay, look at this, 6-second strips, 1, 2, 3, 4, 5, 6-second strip. The rates are regular, they are regular. And what about the rate? rhythms are regular, 1, 2, 3, 4, 5. So it's like about 5 times 10 is 50 beats per minute. So it's not 60, so it's Brady, but it's not so as bad, okay, because he is the sporty person. Okay, so when you actually do that, it's very difficult because the graph I can really see it, but let's assume P, 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 P. So all the P's are okay, all the QRS are okay, or you know, so you have atrial, ventricle, depolarization. Everything is all right except the rate. So it's bradycardia, okay? So bradycardia. So because he is the very young and road runner, sporty person, they might not do anything, but they will just make him or her have more diet, or like more protein diet, more nutritious diet, or a drip or something. So the volume will make the heart rate a little higher, and she will be able to manage his or her weight as well. Might not, I doubt it's gonna be starting with the atropine at all, because it's not so bad. Okay, another case study, 8-month-old, okay, not even a year-old, admitted with the RSV with retraction and head bobbing. Vital signs, temperature 97.8, not bad. Pulse rate 40, no. 40 is less than 60, but 60 to 100 is the adult normal heart rate. And baby, it has to be a lot higher, because baby heart is small, very, very small, and blood pressure is also low. It's kind of low side, but remember, this is the baby. Okay, so this 8-month-old baby is admitted for respiratory syncytial virus. It is a virus for the respiratory, and because of the virus, the baby is suffering kind of hypoxia, cannot breathe well. So the body tried to react it with the retraction. That means like baby is trying to suck the air into the body using the abdominal muscle. So like, you know, it's kind of like you can see the baby belly that's sucking the air in, okay? Okay, and the head bobbing. Head bobbing, that means like it's like shaking the head, like the head is kind of bobbing, okay? Okay, so vital signs, this one is okay. Pulse rate, okay. This is not okay. If it is less than 60, CPR for the kids, right? Especially this young. And look at this, I have to remember it. So what I remember is the number of 70 and 80, okay? For the newborn 0 to 1 month old, the heart rate, the normal heart rate is 70 to 190 beats per minute. Infant 1 to 11 months old, less than 1 year old, 80 to 160 beats per minute. Children 1 to 2 years old, 80 to 130 beats per minute. Children 3 to 4 years old, 80 to 120 beats per minute. So let's say if you want to if you don't remember all the numbers, if the kids are this young, less than 200, 70 to less than 200 is okay. And if the kids like 1 year old, 1 to 2 years old, 3 years old, 4 years old, 1 to the 4 years old, it has to be at least 80 beats per minute, okay? Other than that, is very, very concerning, okay? So let's see, this is 6 seconds straight, 1, 2, 3. You have like about 3 beats in the whole 6 seconds. That's bad. That means you only have like 30 to 40 beats per minute. 30 beats per minute from here to here, let's say it's 1 beat, so only 40 beats per minute. That's bad, right? And also P before QRS, P before QRS, P before QRS. All P looks like a same P, means same size. And I mean, I can't really see, but as far as I can see, it's less than 3. It is 3 to 5 boxes for the P, yes, and less than 3 boxes for the QRS, yes. So what it's actually doing is, this is bradycardia. It is very lethal. So the treatment is for the kids. According to if the treatment is that the kids doesn't have the cardiac transplant, you can actually give a epinephrine, oxygen 100%, back mask, and atropine 0.1 milliliter per kilogram. So how the weight of the baby is very important, okay? So if you have a kid, or if you are taking care of pediatric population, you must know your patient's weight, not just the age, okay? All right, so you won't give atropine for the kids with the cardiac transplant. Just remember that. Okay, that's about bradycardia. And our next video we're gonna go with the sinus tachycardia and the case study and more. Okay, we're gonna have more stuff going on, so stay tuned.
I can feel the blood creeping up from the heathens. Got will, got fight, got pride, got reason. If they wanna go eat, then you know I'm gon' feed them. If you're coming for me, hope you're ready for a demon. I got eyes in the back of my head, I'm seeing. Take me for granted and you know I'm leaving. I'ma take what's mine with the webs I'm weaving. I could take this crowd from seeing to